Synovial fluid culture, detailed overview. 1. Introduction. Synovial fluid culture is a critical diagnostic tool in clinical microbiology and rheumatology. Since synovial fluid is normally sterile, the detection of microorganisms in this fluid strongly indicates joint infection, septic arthritis, or prosthetic joint infection, PJI. These conditions can cause rapid joint destruction, systemic sepsis, and even death if untreated. Culture and sensitivity testing of synovial fluid not only confirm the diagnosis, but also guide targeted antimicrobial therapy. 2. Definition. A synovial fluid culture is a laboratory test in which aspirated joint fluid is inoculated onto culture media to detect, isolate, and identify bacteria, fungi, or viruses. The test helps determine whether the fluid is infected, which microorganism is responsible, which antimicrobial agents are effective via sensitivity testing. 3. Indications. Synovial fluid culture is indicated in the following conditions: suspected septic arthritis, acute monoarthritis with pain, swelling, erythema, and fever, prosthetic joint infection, PJI, after arthroplasty, unexplained joint effusion with systemic features, failure of empiric therapy in arthritis patients. To differentiate infectious from non-infectious arthritis, gout, rheumatoid arthritis, lupus. Monitoring therapy response in known infected joints. Used for identification of causative organism, bacterial, fungal, mycobacterial, or rarely viral. Determining antimicrobial susceptibility of the isolated organism. Supporting the diagnosis of acute septic arthritis versus inflammatory arthritis. Detecting polymicrobial infections common in traumatic wounds and prosthetic joints. Number 5. Why do need of this test? Rapid destruction. Septic arthritis can destroy cartilage within days. Systemic risk. Infection can spread to bloodstream sepsis. Targeted treatment. Culture helps avoid inappropriate or broad-spectrum antibiotics. Differentiation helps distinguish infection from conditions with similar presentations, e.g. gout, autoimmune arthritis. 6. What happens during test? The procedure is called arthrocentesis, joint aspiration. 1. Patient positioning. Joint exposed and sterilized with antiseptic solution. 2. Local anesthesia is applied. 3. A sterile needle is inserted into the joint space. 4. Synovial fluid is aspirated into a syringe. 5. Fluid appearance is noted: clear, turbid, purulent, bloody. 6. Sample is transported immediately to the microbiology lab. 7. Lab procedures include gross examination, color, clarity, viscosity. Cell count and differential. High WBCs suggest infection, 50,000 millimeters, 90% neutrophils. Gram stain. Preliminary evidence of bacteria. Culture and sensitivity. Grown on blood agar, chocolate agar, anaerobic media, fungal and mycobacterial media if needed. How long for my results? Gram stain report within hours. Bacterial culture results 24 to 72 hours. Antibiotic susceptibility testing 2 to 5 days. Fungal cultures 1 to 4 weeks. Mycobacterial cultures. Mycobacterium tuberculosis may take 4 to 8 weeks. 8. Prepare for this test. No fasting required. Inform physician about anticoagulant use, risk of bleeding. Current or recent antibiotic use may affect results. Usually done in a hospital or clinic setting, not at home. Post-procedure, apply bandage, avoid strenuous joint use for a short period. 9. Risks. Although generally safe, potential risks include bleeding into the joint, hemarthrosis, infection at the puncture site, pain, swelling at aspiration site, rare nerve or tendon injury, especially in deep joints, hip. Normal values. Appearance. Clear, pale yellow. White cell count, 200 cells magrular. Polymorphonuclear cells, 25%. Protein, 3 glial. Glucose, similar to blood glucose. Culture result, normal. No growth of microorganisms. HAC 11. Interpretation results. No growth, non-infectious arthritis, e.g. gout, rheumatoid arthritis, osteoarthritis. Positive culture confirms septic arthritis. Gram-positive cocci, Staphylococcus aureus, Streptococcus spp, gram-negative bacilli, E. coli, Pseudomonas, Neisseria gonorrhoeae. Fungi, Candida spp, mycobacteria, Mycobacterium tuberculosis, tuberculous arthritis. Sensitivity testing determines appropriate antibiotics, antifungals. 12. Factors affecting results. Prior antibiotic therapy before aspiration. Delay in transport to lab, organisms die. Contamination during collection. Insufficient fluid volume. Improper storage. Samples should not be refrigerated for certain organisms. Clinical significance. confirms or rules out septic arthritis, a medical emergency, guides therapy, ensures the right drug is used, prevents irreversible cartilage destruction and chronic disability, helps diagnose prosthetic joint infections, biofilm-producing bacteria like S. epidermidis, detects unusual organisms in immunocompromised patients, fungi, mycobacteria. 14. Know more. Joint infections are most common in knee, hip, shoulder. Gonococcal arthritis is common in young adults, while Staphylococcus aureus is the most common cause overall. Culture should always be paired with gram stain, WBC count, glucose, protein, and crystal analysis. Molecular methods. PCR 16S RNA sequencing are increasingly used when cultures are negative, but infection is suspected. 15. Conclusion. Synovial fluid culture is a gold standard diagnostic test for joint infections. By identifying the exact organism, it ensures rapid diagnosis, targeted treatment, and prevention of joint destruction. Despite minor procedural risks, its clinical benefits make it indispensable in managing septic arthritis and prosthetic joint infections. Thank you. Have a nice day.